What foods benefit the joints? Is it necessary to take special vitamins? Should you give up certain foods? Should you eat more or less? Is aspic good for articular cartilage? Now we will help you figure this out. Before we move on, please subscribe to the channel to get notifications about the new videos. We're doing our best to create interesting content for you. The most common articular disease is osteoarthritis or just arthritis. Usually, the disease develops in old people, but sometimes it can also start at a young age because of an injury or joint overload. The most common symptoms are joint pain and stiffness. Usually, the symptoms progress slowly over the years. Initially, they may occur only after exercises, but can become constant over time. Other symptoms may include joint swelling, decreased range of motion, and when the back is affected, weakness or numbness of the arms and legs. The most commonly involved joints are the two near the ends of the fingers and the joint at the base of the thumbs, the knee and hip joints, and the joints of the neck and lower back. Does the person's diet influence the disease? Nowadays, medical remedies are the most common way of treating arthritis: articular cartilage strengtheners, pain relievers, and anti-inflammatory drugs. But osteoarthritis is one of those joint diseases the treatment of which depends mostly on the efforts of the patient. First of all, it's about healthy diet. A well-balanced diet helps get rid of the excess weight and so reduces the stress on the joints. In addition, the right food can even reduce the joint inflammation. So a therapeutic diet in case of osteoarthritis is aimed at restricting the substances causing inflammation and reducing body weight if necessary. If osteoarthritis comes with age, why should I lose weight? Overweight people are more likely to develop osteoarthritis. When walking, some of the joints like hip, knee, and foot joints get a load which is 5 to 6 times higher than the person's weight, so it's not surprising that obese people suffer from arthritis more often and usually have more severe forms of the disease. In addition, excess body fat is one of the factors causing inflammation. Losing weight not only reduces the load on the sore joints, but also makes motions easier. This helps to get rid of slowness and allows you to burn more calories. Losing weight is never easy, but even losing just a few pounds will be significant. Along with the relief of joint pain, the patient will feel a general improvement of the condition. How do I know if I'm overweight? Body mass index is a value derived from the weight and height of a person. It's defined as the body mass divided by the square of the body height. Commonly accepted BMI ranges are underweight, under 18.5, normal weight, 18.5 to 25, overweight, 25 to 30, and obese, over 30. What should you eat? A well-balanced diet should include all the essential nutrients: proteins, fats, carbohydrates, vitamins, and minerals. The key issue is the ratio of these components in the diet. Today, nutritionists recommend the following ratio. Fruits and vegetables should make up 1/3 of the diet. Bananas, grapes, and potatoes are not recommended. Another third is for cereals, for example cereal bread, muesli, as well as porridges and unpolished cereal side dishes. Actually, different kinds of durum wheat pasta also may be included in this part, but many nutritionists still do not recommend them in common everyday diets, since wheat flour products are excluded from many medical dietary regimens. 1/6 part goes to dairy products, milk, cheese, and various fermented milk products, except for cream and butter. 1/8 part of the diet is for protein products, fish, meat, eggs, and legumes. The remaining small part is for products that are not recommended, like confectionery. However, one should not forget that for a number of conditions such as diabetes, gout, or diseases of the gastrointestinal tract, there are special therapeutic diets in which the ratio of the products may be different. I cannot lose weight. It's impossible. Many overweight people are convinced that their obesity is the result of hormonal, metabolic, or age changes and stress, and so it's pointless to even try to change it. But this is a delusion. Hormonal disorders are the cause of only a small percentage of obesity cases. Much more often, regardless of age, metabolic rate, or psycho-emotional background, obesity is the result of malnutrition and lack of physical activity. If a person receives more energy from food than they spend during the day, then the excess energy turns into fat and weight gain occurs. If a person receives less energy than spends, then the opposite happens, they begin to lose weight. So all recommendations for weight loss are based on normalizing nutrition and increasing physical activity. So just eat less and exercise more. It's not that simple. What you need is not to eat less, but to gain less calories. And of course, move. Walk at least half an hour a day, do fitness, swim, dance, or workout. but I can't move more because of my sore joints. It's obvious that for people with musculoskeletal conditions, an increase in physical activity is difficult for objective reasons. First thing recommended in these cases is to practice the available types of physical activity, special sets of exercises, isometric gymnastics, and others. Secondly, it's recommended to reduce the calorie content of the diet, since a person who doesn't move much does not need much energy. So do I have to starve? No, of course you don't. This is not about starving, but about reducing the calorie intake. Calorie content is measured in kilocalories. Kilo is omitted for brevity. Losing weight requires fewer calories to enter the body, but there still must be sufficient amount of vitamins, minerals, and other nutrients, so it's not starving, it's optimization. What diet is the best? Remember, don't crash diet if you want to lose weight and keep it off in the long term. Crash dieting even sounds dramatic, and it can be, but not in a positive way. Many people embark on a harsh, low-calorie diet to lose weight quickly. People who crash diet think that less is more, but if you diet too hard or too fast, your body will eventually fight back. You could end up in a worse position than when you started. There's no medical definition for a crash diet, but there are some red flags to look out for. A crash diet will expect you to slash your calories right from the start, often to a level below your BMR, the amount of calories your body needs to survive. Crash diets often make lofty promises about how much weight you will lose in a week or fortnight. Statements like lose half a stone in a week or lose 16 pounds of fat in a month are not uncommon. But do they actually work? Yes, going on a crash diet often delivers short-term results. By cutting your calories so low and making drastic changes to the type of food you eat, your body will shed weight. But there are lots of problems with this dramatic approach to losing weight. You will lose weight, but it won't all be from unwanted body fat. You will also lose precious muscle tissue. Your metabolic rate will drop, making it harder to lose weight in the future. And you risk severe food cravings and binges on a crash diet. The rebound effect from crash dieting can be severe. You could be left clueless about how to get back on track. So, if you want to reduce body weight effectively and without harm, think not about decreasing the amount of food, but about optimizing the diet, which means reducing the calorie content of food while keeping the sufficient intake of nutrients and vitamins. But what about eat your breakfast, share your lunch? Well, organizing meals throughout the day is an important question too. If you don't have conditions requiring a strict hourly diet, for example diabetes, peptic ulcer, or cholecystopancreatitis, then you can follow two rules. First, eat only when you feel hungry, but never because you just have nothing to do. Second, the last meal should take place no later than 5 to 6 hours before bedtime. If you feel hungry during these hours, you can eat an apple, low-fat yogurt, or drink a glass of milk. What is the normal rate of weight loss? The most healthy and effective way is losing weight gradually, which is 1 or 2 kilograms per month. 5 tips to reduce the calorie intake. 1. Limit fat intake. Fat tends to be considered bad because it's associated with weight gain and high cholesterol. However, certain types of fat protect the heart if you don't eat too much of it. The key is to understand how to choose the right amount of each type of fat, so we should look closely at the ideas of total fat and each type of fat. Total fat. The dietary reference intake, or DRI, for fat in adults is 20 to 35% of total calories from fat. This is about 44 to 70 grams of fat per day if you eat 2,000 calories a day. It's recommended to eat more of some types of fats because they're good for the body, and to eat less of other types of fats due to the negative impact on health. The norms are monounsaturated fat 15 to 20%, polyunsaturated fat 5 to 10%, saturated fat less than 10%, trans fat 0%, cholesterol less than 300 milligrams per day. Let's talk a bit about each type. Saturated fats are generally solid or waxy at room temperature and come mostly from animal products, with the exception of tropical oils. Taking in too much saturated fat is linked with raising levels of bad cholesterol in the blood and increasing internal inflammation. Healthy adults should limit their saturated fat intake to no more than 10% of total calories. Foods high in saturated fat include beef, pork, lamb, veal, and poultry skin, hot dogs, bologna, and salami. High-fat dairy products such as cream, ice cream, whole and 2% milk, cheese, and 4% cottage cheese, butter, lard, and bacon fat. Bakery products such as cookies, pastries, and croissants. Cholesterol is made by the liver, so only animal-based foods contain cholesterol. If your cholesterol levels are normal, limit your intake to up to 300 milligrams per day. If you have been diagnosed with high cholesterol, limit your intake to less than 200 milligrams per day. Unsaturated fats are usually liquid at room temperature. When used in place of saturated fat, mono and polyunsaturated fats help lower cholesterol levels. Monounsaturated fats come from plant-based sources, which include olive, canola, and peanut oil, nuts and nut butters, olives and avocado. Polyunsaturated fats come from plant-based sources too, such as safflower, sunflower, corn, soybean, and cottonseed oils, as well as various kinds of nuts. 2. Use grill and steam for cooking, and if you do fry in a pan, use olive oil. 3. If you need a snack, eat fruits and vegetables. 4. Limit sugar intake. Eating too much sugar is one of the worst things you can do to your body. It can have many negative effects on your health. It has been shown to contribute to obesity, type 2 diabetes, heart disease, cancer, and tooth decay. While sugar is naturally found in foods like fruits and vegetables, this type has little effect on your blood sugar and is considered very healthy. Fruits and vegetables also contain lots of healthy vitamins and minerals. The danger is from added sugars in processed foods. Here are some tips to limit your sugar intake. Cut back on sugar-filled drinks. Avoid sugar-loaded desserts. Avoid sauces with lots of sugar. Check for sugar in canned foods. Consider natural sweeteners. 5. Eat more fruits and vegetables. The World Health Organization recommends eating at least 5 servings of fruits and vegetables a day. This way you can be sure that the body receives enough vitamins, minerals, and antioxidants, which are necessary for the health in general and for joint health in particular. Antioxidants are especially important since they reduce inflammation. It's recommended to include fruits and vegetables of different colors in the diet to ensure the supply of various vitamins and other nutrients. Let's take a look at serving sizes of different vegetables and fruits. Half a grapefruit, bell pepper, avocado, or mango. 1 medium-sized apple, orange, peach, banana, tomato, or onion. 2 plums. 2 tangerines. 2 rings of pineapple. 2 pieces of broccoli. 3 stalks of celery. 3 tablespoons of grated carrots, beans, or fruit salad. 5 stalks of asparagus. 6 cobs of mini corn. 8 cauliflower blossoms. 14 mushroom caps. 1 tablespoon of raisins or dried fruits. Handful of grapes. 150 milliliters of fruit juice. For juice, only 1 serving counts, no matter how much juice you actually drink per day. Summary: in case of osteoarthritis, the nutritional optimization helps to get rid of excess weight and reduce inflammation. So the patients with osteoarthritis should analyze their diet, the types and the amount of food, its calorie content, and meal regimen. Limit the intake of sugar and fats, especially saturated fats. Include unrefined vegetable oils containing omega-3 polyunsaturated fats to the diet. Eat at least 5 servings of fruit and vegetables every day, since it's necessary for sufficient supply of vitamins. Choose products with high calcium and iron content. Try to replace meat with fish. Eat fish at least twice a week. Remember about individual food intolerance. If certain foods are suspected of causing increased joint pain, exclude them from the diet. Don't change your diet significantly without medical supervision. Remember that in case of osteoarthritis, diet is only an additional but not the main part of the treatment. Make sure that your diet is right in general, and then concentrate your efforts on the most optimal use of other remedies. That's all we wanted to tell you about today. On Big Progress, you will find videos about the benefits of various vegetables and fruits, information about diseases and how to cure them, and many other interesting facts about gardening and housekeeping. So make sure to subscribe to the channel and ring the bell, like the video if you've learned anything new, and share it with your family and friends. See you soon!